Thank you. Bob Herbert said a few years ago about a federal budget that was coming through that it was a budget that mugs the poor and helpless, that is a blueprint for economic disaster. It begins to feel like that, which is why it's so important for us to get into the very specific parts so we can advocate well and point out the false economies, because that is what I see, is that this is more of a story of false economies at the expense of women and their families. I want to talk a little bit and pose questions about women's health care, and you've heard a little bit about that this is a big deal in this budget. This shouldn't surprise us. When we spiraled down into this economic disaster and President Obama took office and we had a stimulus bill and then a difficult budget to write, in both cases, women's health care was the bargaining chip, right? First thing on the table was women's reproductive health care and the stimulus plan, and they knocked it right off. And the same thing with the budget. And it's rather unseemly to see these bodies of 80% men playing with the access to integral health care for women as their point of bargaining. So I want to pose this question, and Molly and Sandy have special expertise. This week is National Women's Health Week. And can you talk about how reproductive health and family care impacts the families and communities across the state? How does this budget issue play out on a larger scale?
Thank you. Well, you already talked about the cuts to reproductive health and the cuts to Badger Care. And this is a briefing paper that just came out in April. It's the Institute for Women's Policy Research. It's entitled Women, Poverty, and Economic Insecurity in Wisconsin, the Milwaukee area. Nearly 2/3 of all households in poverty are headed by single women. So when we talk about poverty, we have to think about many of these households are women-led households. And as I mentioned, the budget is already cutting into the W-2 program and the Badger Care program. The first issue that dealt with the collective bargaining rights when that came out, there was a lot of tumultuous times in Madison around that. And it also involved a lot of demonizing of teachers. And we have teachers who are men and teachers who are women, but I think a lot of people still see teachers as something that my wife does as a second income job. In fact, I got a lot of letters from people saying, my wife's a teacher and she doesn't need to make all that money because, you know, I mean, I couldn't believe that I was actually hearing what I was hearing. Whatever job that we have, it should be a job that allows people to raise a family and to raise a family in a really healthy way. So, I mean, there are direct assaults and then there are these kind of around the edges kind of assaults. When we look at Badger Care, a discussion I had with the Secretary of Department of Health Services talked about bringing things to the 100% of poverty level. Right now, we cover at a higher level. We cover 200%, and federal covers at 133% of poverty. 100% of poverty is really, really, really poor. And if we are going to expect people to manage their health when they're just above 100% of poverty, I think what we're going to do is see a lot of cost shifting into emergency rooms and hospitals. Covering health care is an issue. Health care is very, very expensive, and instead of really dealing with the root of it, how can we provide good quality health care at an effective way for people with chronic illness and prevention? And that usually doesn't get discussed when discussions on how do we deal with the rising health care costs and the growing part of the budget dealing with Medicaid is how do we limit access to that? As if you stop providing treatment, people will somehow miraculously get healthy. And that doesn't happen. People still get sick whether they have insurance or not. And they will end up in emergency rooms if they don't have access to good early treatment, preventive treatment, etc. And then that cost is shifted around. The cuts on reproductive health are also very short-sighted. There seems to be a lot of interest in what happens to a woman before she's pregnant, and some while she's pregnant, not as far as access to perinatal health care, but just in regard to choice issues. And then once the child is born, there seems to be a huge drop-off from a lot of interest as to how do we keep this child alive and healthy. Infant mortality rate in southeastern Wisconsin is another thing we should all be just absolutely ashamed of. It is higher than that found in third world countries, and there are things that we can do to address that. There was a discussion yesterday, it's making the headlines now, but we can't just let this be something that we pay attention to only when it's in the headlines and let it drop off. And what the research shows, I mean, the issues related to women's health and infant mortality are many and complicated, but one of the things that keeps babies alive and women healthy are making sure that they have access to health care before they're pregnant and between pregnancies and after pregnancy, not just jumping in as soon as they get pregnant and dropping off. Again, this is something that if we don't care about it from a moral point of view, I think we should care about it then from an economic point of view, that sick babies are expensive and that we're going to be paying for them. But of course, we should look at it from a moral point of view too, that this isn't the way that I would think we want to take our state. I mentioned shipping costs. I'll pass this on and say more.
It's really simple. Reproductive health care protects our health and it can save our lives. When we're talking about reproductive health care, we are talking about our annual exams, our breast and cervical cancer screenings, STD testing and treatment, birth control. This is all very basic health care for women. We are also talking about access to safe abortion. And unfortunately, we are going to see this legislature try to chip away at the rights of women's rights to have a safe abortion. Their research time and time again shows that when abortion is illegal or is inaccessible, mothers and women's and children's health care suffers. And as an interesting fact, it is National Women's Health Week, and Governor Walker has also declared this week to be Women's Health Week in Wisconsin. It seems a little bit hollow that he makes this declaration and then takes away all of these different rights and access to all this different health care in our state. If it were a priority to Governor Walker, women's health care, he would not be gutting these programs. He would not be eliminating state funding for health care programs. And these are services that women rely on, and he's taking them away.